Before I come into the room, make sure I have all my supplies. I will have my NG tube, the size based on the patient. This is an adult. I'm assuming that 14 French would be average. I will get my tape, my 60 cc syringe kit. I will get a specimen cup to do my pH strips, a cup with either some ice or some water, some tape, a sheet or chuck pad to put over my patient. We are going to use I thought I had a shirt. Oh, yes I do. I'm going to use my shirt because I don't have anything. So anyway, I want to make sure I have everything for my patient. Come in. I'm going to introduce myself. Hi, I'm Angela. I'll be your nursing student today. I'm coming to insert your NG tube. Person's going to say, hey, I'm going to ask how they're doing. Do they have any pain? Any allergies? Make sure off the top, if the facility has, which I'm sure most facilities do, make sure I get a latex free, just in case I want to have to go back and come back again. So I'm gonna hand hygiene, and I'm gonna go ahead and I'm gonna check my canisters in the room first, the suction canisters, make sure everything's all hooked up the way it should be. I'm going to also make sure that my suction canister, I don't want to hear that noise, but sometimes it isn't that loud, but maybe I can just go ahead and set it up for the slow intermittent. So where's my pen light? I just had my pen light. We're gonna have to pretend I have it. I must have set it down somewhere and I don't want to get up. We're gonna pretend like this is a pen light for now, since I can't find it. I don't want to start this video over. All right, we're gonna take a look at the nares. I'm gonna tell the patient, hey, as I insert the NG2, I just want to do a quick assessment, making sure that everything is okay. And of course, like I said, the patient says that they're fine for the most part. And I'm gonna check the nares, make sure there's no polyps, no deviated septum. Ask the patient, do they have sinus problems? Have they had a fess? Are they known to have sinus problems? Are they in pain? Things of that nature. After I check the nares, the left and the right, no occlusions are going on, I'm going to make sure I have it with me, of course, a tongue depressor. Check their gag reflex. And then I'm going to begin. Once again, hand hygiene. I'm going over the top of my head. I'm going to do hand hygiene again, put some gloves on, and I'm going to measure. Make sure I have my stethoscope with me because before I start to do anything, I'm going to draw back. I have a small syringe for the purposes of this. We're going to pretend it's a 60. I'm going to draw back about, I don't know, maybe 10 to 20 cc's of air. So now I want to, once again, make sure my patient is comfortable. I want to measure from the nose to the ear. And I want to hold on to it, and I'm going to come down to my patient to the end of their xiphoid, which is about right here. My little teddy bear is measuring nose to the ear. He's an odd-shaped fellow. He, surprisingly, is at 19, so I'm going to hold my finger there, make sure it doesn't flail around, and I'm going to either mark it or put some tape on it. All right, so I marked it. I'm going to take some tape off, and I'm going to start this tape off, and I'm going to get some tape, just to start my tape, so that way it's easy for me to do it. I have the ability to do the tape in half, and then I can just put it back. That when I'm ready to take it apart, I have everything. I just don't want things sticking to one another, and I like to be prepared. So boom. As you can see, I've split it, preparing it for the... Okay, I'm going to tell the patient, this is without a doubt, it will be a little uncomfortable, but I'm here, and whenever it does not feel okay to you, then say something, and then I will try to readjust to not make it so painful. I'm going to take my little, put that bad boy on, drape my patient, make sure that they are Fowler upright and not straight up, but I'm going to tell my patient to take their water with this straw. And I'm going to tell you to, as you swallow, I'm going to advance. So when I tell you to swallow, relax, and I'm going to advance. Okay? All right. I'm going to lubricate the first 4 inches. Like I said, I marked it off at 19. So I know how far to go down for this patient. I'm going to tell her or him to put their head, tuck their head. And of course, this is huge for this poor little thing. They're going to do this. If they do that, just say, you know, just bear with me. And we're going to tell her that once again. Drink, swallow. Drink, swallow. I would rather do the tape method because I feel like it'll just be better and I can visually see it. And so we have it where we need it. Okay, so now we have it there, right? All right. I have my tape already done. So I'm going to I can't honestly tape on this teddy bear. We're going to try and tape it to the teddy bear. I'm going to take it and wrap it. Oh, I can't get it like I want to. But the 2 tapes is to get it over. You're wrapping it around the tube without yanking it out, obviously, and you're also getting it to the nose or the side. And then, of course, you're going to come with your second piece of tape. And it's falling because, you know, it's a teddy bear. We're going to take our second piece that I already have free. And we're going to tear it. And we're going to bring it across the nose and I have to do a longer piece because he has a big schnauzer. Okay, and that'll be that. So hopefully it goes like that. And then we're going to tape, and we're going to use, we could tape, I like to carry safety pins around by default because I'm a female, that's what I do. And then I'll take one of my safety pins and I'll safety pin it to the patient's gown. Now, with my stethoscope, I'm going to listen. I'm going to listen to my patient, and then I'm going to listen first, then I'm going to add the air. I'm going to listen again, and we should hear bubbles because, you know, that's because it's air. There's air going into an empty situation. So then I'm going to draw back about 4. When I draw back to 4, I'm going to put this over there. I'm going to reattach this for just a second while I go make sure the patient is okay. See, it came off. And I'm going to put a little bit in my cup. Let's see, you know, I'm going to put in a cup. And we're going to do the pH strips. We're going to check and see if we are where we need to be, which is between, what, 2 to 4. Let's just say for the purpose of this video, it's at 2. So we're where we should be. And then we're going to connect it to the suction just to get a little bit, not a lot, because you definitely don't want to cause any type of electrolyte imbalance. Everything is everything. If you want to, you should get an x-ray, get the portable in here just to make sure you are in the right spot. And that pretty much should be that. So then you take all your stuff, everything's secure to your patient, you take your pH strips, everything that you brought into the room, and you put it into the trash can. You take away this. Once again, you ask your patient if they're doing okay. They say that they are. You're going to do your hand hygiene. Obviously, you're not so connected to the suction. Just wanted you to know that. I did the suction and I took it off. If anything made it into the little canister, obviously, you might want to change it. It's up to you. I'm not sure. Some hospitals want you to change it. That's just what I heard. And that is pretty much it, I think. But you'll critique me and you'll tell me what I did wrong. I feel like I did it right. and I've made it to 10 minutes. Oh my God.